I'm really heartened by the Reforming from Within and the medical engagement reports, because I entirely agree that medical engagement is a journey, not an event. And my journey probably began around 3 or 4 years ago. And it was a huge challenge to make the case for medical engagement per se, full stop, to actually want to focus and dedicate some time to look at why it was important for us at the time in our mental health trust, and why it would add value. So it was great to have some of the data out there. It was key in getting going. And also, as a trust, we participated in the medical engagement scale. So that was also a good place to start, because we were in the bottom 1/3 of trusts with low overall medical engagement. The only way was up, is how I saw the journey beginning. I couldn't do much worse. But it was really concerning and worrying, because we had a disenfranchised, disconnected medical workforce who were not shareholders at all. They were stakeholders, coming to work and going home. So I reflected and took a long time, spent many sessions with my mentors reflecting upon this, and thinking through with colleagues who were senior and more experienced, through to trainees that I was training and junior doctors, to really get that powerful consultation without actually running consultation events or focus groups. It was very much about having coaching conversations and courageous conversations and listening. So really listening, and then going home and reflecting, what one thing am I going to do? I was lucky then to be able to have the opportunity to go for the Associate Medical Director position, and we were going to align my vision for starting this medical engagement with a restructure, a medical management leadership restructure. So we dedicated the position that I'm in, although a deputy medical director role, we dedicated the position to medical engagement and leadership, so that it was a title, it was given visibility, importance and identity, and that real message that there was organisational buy-in to this from the board to the workforce. But I guess I got some of my inspiration for that first 100 days was going to be key. How are we going to make an impact so that this doesn't become tokenistic and yet another initiative by the NHS done to us or thrown upon us? And I forget her name, but inspired by the appointed CEO of Pepsi Cola, who must have had a huge workforce, but did something very simple, which lots of us have done before, but in a slightly different way, and wrote personally to each member of staff. So that was one of the things that I did right at the beginning in the first 2 or 3 weeks. I wrote personally to each medical member of the workforce. I was lucky that we only have between 100 and 150 medics, but it's the principle. And although I didn't realise it at the time, when we have had feedback and we've gone along our journey, that was one of the most quoted reasons as to how valued people felt very quickly, and how they thought that perhaps this was different, that medical engagement was being taken seriously, medics were being taken seriously. Because 2 of the key things that came from our medical engagement scale when we looked at the results in more detail were interpersonal relationships. Medics felt that they were not just poor, were awful, and that wasn't necessarily within the medical workforce themselves. It was as an organisation, internally and externally. And the other area was having a voice, so feeling valued and empowered, but having a voice to make collective decisions with the organisations, that their expertise and their role was valued. Mm-hmm. So those were the 2 areas that I chose to focus on. And it wasn't about replicating and duplicating excellent programmes that were going on nationally or that you could tap into. It was about doing something different and complementary to that. So very much where I was coming from was that we needed to do something that was local, that was something about the organisation in which those medics worked, so that they became the shareholders, not the stakeholders. There was ownership and a feeling proud to go to work for that organisation. On reflection, reflecting back on the last 3 or 4 years, the one thing that I would do differently if I could go back is in probably starting the idea of collective leadership right from the beginning of that journey. So although I do believe strongly that the medical component of engagement and leadership is really key, and I make no apologies about that, and we've done lots to collaborate, I think that collaboration and collective approach to engagement and leadership of staff, I think I would have started that much more collaboratively right from the beginning.